Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing the 6 pillars or concepts to taking care of chronic wounds. But first, if you could hit that subscribe button, it would be greatly appreciated as it does help my channel reach more people. So let's get started, guys. So what are the pillars of chronic wound care? So we have all heard of the concept, look at the whole patient and not just the hole in the patient, okay? We also need to have a good foundation of how to implement this phrase. Like, where do we even start, right? We know that we need to look at the patient as a whole, but where do we start, okay? So that's where the 6 pillars or concept of chronic wound care comes into play, with easy to understand pillars when you're caring for a patient with a chronic wound. So pillar number 1. So this is understanding and controlling the underlying disease process. So we all know that chronic wounds are not a disease process in itself. Often the wound is a product or the symptom of having an underlying condition, okay? So this may be from like venous disease, cardiac heart failure, diabetes, autoimmune disorders, lymphedema. The list literally goes on and on. One of the first steps to managing a wound properly is to identify any underlying factors that may be contributing to the wound, okay? Is there pressure? Is there uncontrolled diabetes, obesity? What is going on within the body? Okay, so that's pillar number 1 that we need to look at. So wound bed preparation, inflammation, and infection control. So if you've ever worked in wound care, you have heard of the concept time, okay? It has been now updated to timers. So if you're not aware of that, please look that up. I'll link a video up above, down below, somewhere. I'll have it in the description or somewhere on this video, wherever it ends up. But that is a new update for timers. It adds repair and social. But we also need to start looking at things like pH management and inflammation control, because there's a lot of new products out there on the market that are aimed to address these factors, okay? So number 2, so the concept number 2 that we're going to be looking at is wound bed preparation, okay? So our next pillar, okay, or category is nutritional support, okay? So we need to be looking at the nutritional status of our patients. We can have patients who are overweight or obese, and they can still be malnourished, okay? So a lack or imbalance of proper micro or macronutrients can put their already strained body in a position where they're unable to heal, okay? All of these issues can impact wound healing. So we want to make sure that we are connecting and referring our patients to a dietitian who can help them manage the problems and supplement them with vitamins and minerals, anything that their body is lacking, okay? I always like to tell people we want to be eating from the outside aisles of the grocery store, okay? So how grocery stores are set up, you normally walk in and you see the fruits and vegetables, and then around the whole outside perimeter, you go into your meats and your dairy. So it has all your food groups around the outside, okay? Your breads, all this stuff is around the outside perimeter. We want to be eating from these areas. That's where we're going to get our most nutritional foods, okay? And a lot of times patients who have wounds or are trying to heal, sometimes they really have no appetite. So we want to make sure that the food that they are getting definitely has the nutrients in it, okay? When we start eating from the aisles, it's a lot of packaged processed foods, okay? So we want to kind of stay away from that and go more natural things Eat from the food pyramid and not the processed junk that a lot of us do eat. So pillar number 4, mental health. Okay. Many times when we're treating patients for wounds, this is really overlooked. Okay. So having a chronic condition, such as a wound, because a wound is a chronic condition, patients can have increased depression or anxiety. And there was a study that found that almost one in like 50%, we're almost at 50%. It's 45.3% of people with wounds are depressed or have high amounts of anxiety. So we need to help them deal with things associated with wound care. Like, what are they dealing with? Because the wound, sometimes it's just the straw that broke the camel's back. Okay. And they're really struggling to deal with that. So what's their access to supplies or care? Is the patient homeless? Are they on a fixed income? Are they having to choose between a meal and a dressing? Okay. I know in Canada, yes, we can get the dressings for free if we're under certain care, but a lot of times that care only lasts for so long too. So, and I know a lot of other places you're paying for everything, even seeing the doctor. So that can be an issue. What's their mode of transportation? Are they even struggling to get to the appointments? Okay. So we need to look at all aspects when it comes to the wound. And we want to make sure that the patient's not getting in that crisis zone of depression and anxiety. Okay. We want to help them deal with everything. Okay, pillar number 5, adjunctive therapies. So these are your more advanced wound care therapies. Okay, they can improve healing times, especially in those hard to heal wounds. There are several new therapies from electrical stimulation to advanced cellular tissue products. I'll link a video up above because I did just put out what's new in wound care, and it had a lot of these in there. So I'll add that up above. Several studies have shown that early application of these advanced therapies, such as negative pressure, wound pressure therapy on hard to heal wounds, they do have better outcomes. Okay. They're also more cost effective because, yes, they're more expensive in the short term, but it's not like we're trying to throw all these different wound care products at a wound to get it to heal, and it doesn't heal over a long period of time. Okay, so in the short term, yes, it's more expensive for that short period of time, but overall, to close that wound, which the goal of every wound is to close it, it will be less money and more cost effective. Now, prevention. So pillar number 6, prevention. Now, this is actually one of my favorite pillars. Okay. And for me, that's exactly why I have this channel, because prevention over cure is so important. That is why I love talking about prevention, because if we can prevent something from happening, it's so much easier than curing it. Okay. But prevention in regards to wound care here, and this is the final pillar. We all know that when it comes to, say, pressure ulcers, prevention is key, right? We want to be moving the patient so that we're not having pressure in a spot for too long. But what about when a patient has a venous leg ulcer or a diabetic foot ulcer? We need to be teaching prevention, because the reoccurrence rate of a diabetic foot ulcer is between 30 to 78%. This is a huge impact. So if we're putting in a system and educating our patients, honestly, if we just educate our patients, we can bring that number down by so much. Okay. And so in the community where I was working, it is quite small. So when patients would come in, when I would see patients for wound care, if they had a reoccurrence, I'd be seeing them again. Right. So I would know, okay, maybe my education wasn't as effective as I thought it was. So then I would have to really talk and sit down with them and have no distractions with the conversation. So a lot of times I'll be educating as I'm doing wound care. But sometimes we have to bring it to the point where all that patient is focusing on is this conversation, because prevention is 100% key in reducing the risk of having more issues. So whether it's venous leg ulcers, making sure they're aware, okay, yeah, we had you in wraps, but now we need to have a system in place for when those wraps are done. We have them in compression stockings, something that they can put on and wear for life, and make sure that they know that this is a lifelong problem. And instead of taking a medication, we need to be wearing these. So it is our medication. Those stockings are our medications to prevent the venous leg ulcer, or specialized footwear and orthotics. This is our medication to prevent another diabetic foot ulcer from happening. Okay. Or even regular checks, teaching them they need to be looking at their feet daily, twice a day, before they put on their shoes in the morning, and then when they take their shoes off at night. We need to teach them how important it is to stick our hand inside of that shoe before we put it on our foot. Look at the shoe underneath. What if there's a tack that the patient has neuropathy and they can't feel? So we need to be looking underneath and looking inside the shoe to make sure that there's nothing in the shoe, that there's nothing underneath the shoe that could be poking them. Okay, we need to be teaching these things. So the 6 pillars is really a holistic way, evidence-based practice to look at the whole patient instead of just that hole in the patient. Because as you've seen, there's so much more that we're looking at, rather than just looking at that hole and wound bed preparation and what are we going to be using on that wound. Okay, so there's so much more that we need to be looking at, and optimizing their health always around, looking at their mental health. So using these 6 pillars can really optimize wound healing and get those wounds to heal quicker. So I hope this video did give you a better idea of what you should be looking at when you're looking at your patient that has a chronic wound. But that's all I have for this video, guys. I hope you have a wonderful day, and I hope to catch you in my next video. Bye for now.